Hello, I'm Dr. Lorraine Maita from howtoliveyounger.com. And I want to talk a little bit about how an executive physical can help you function at your peak. Do you know that Rolling Stones song, I Can't Get No Satisfaction? Well, that's what my patients tell me when they go for routine physicals, their annual physical at their primary care physicians, or even when they go for these very, very expensive executive health evaluations. I was the chief medical officer in charge of executive health and preventive health and wellness, as well as health and productivity at 3 Fortune 100 companies. And executives came to me with thick, thick binders of tests that were done. And they said to me, Lorraine, Dr. Maita, I still don't know what to do. I still don't feel quite right. I'm not functioning as well as I could be. And this didn't give me any insight. All this time and all this money, I still don't know if I'm doing the right things to maintain my health. Eat right, exercise, get enough sleep. Yeah, I know all those things, but I'm not really sure that I'm on track. I'm not sure that all the things that need to be looked at were looked at. It's important to go for these exams because you get all your early detection screenings. These are not really preventive health screenings. They're there to detect things early. It's a checklist. Colonoscopy, stress tests, blood tests, stool tests. So they come out of these exams with the information, maybe you don't have cancer and you don't have heart disease, or you may need to lose weight and exercise more. But there are big holes in those exams. And there's a lot of things that they don't look at. The Vibrance for Life executive physical that I have developed after visiting many executive health clinics throughout the country and participating in them myself. I was an executive myself, so I know the pressures and stresses that people were under. And I've seen people from many, many walks of life, executives and non-executives, that just aren't functioning as well as they could be and not looking at all the things that they need to look at to assure healthy aging and living a full and vibrant life. Well, the Vibrance for Life executive physical covers the bases, all the bases that those other exams don't cover. It's a unique perspective of integrative medicine, functional medicine, anti-aging medicine, and personalized medicine. And you get me. How important is it for you to understand your genetic blueprint, how you're wired, and how to work with that? Just as an architect needs a blueprint in order to build a strong and sturdy structure, you need to understand your unique genetic blueprint so that you can have vibrant health. I do personalized genetic testing that will get at what is the best diet for you? What's the best exercise? What are the habits that get thwart your health and get in the way? What are the habits that you can build upon that are going to keep you healthier and stronger? This is a very important information for you to know and understand and to work with, because then you can unleash your full unlimited potential. Isn't that great? And what about the physical biomarkers of aging? Now, you can tell if you have a big belly and a big waist to hip ratio and your body composition is more fat than muscle. That's important, and we'll get to that. But are your arteries too stiff? Do you have enough nitric oxide? How about your balance or reaction time? These are things that can lead to accident, injury, and other serious illnesses. But if you don't look for them, you don't measure them, you don't know where you stack up against others your age, or where you stack up against where you were a few years ago, how are you going to know something is wrong unless you look for it? I'll bet none of you have had balance testing, reaction time testing, cognitive function testing, genetic testing, and all this to uncover what's lurking beneath the surface. Even some of the blood biomarkers of aging and ill health aren't always covered in these exams. I look at most of the things that are really important for you to understand how you're aging. How healthy are you? What's lurking beneath the surface? Are you inflamed? Is your C-reactive protein up? Do you have early signs of metabolic syndrome that are going to lead to obesity, diabetes, high blood pressure, high cholesterol, heart disease, stroke, chronic illness? Are you looking at the right things? Are you looking at fasting insulin, hemoglobin A1C? Sometimes insurance doesn't always cover these things, but if you don't look for them, you're not going to find them, and then you can't do anything about it until it's too late. Because the definition of illness is very strict. But what's healthy and optimal is very broad. What's healthy is defined as very broad, but what's optimal is somewhere in the middle. That sweet spot in the middle, and that's what you're looking for. And you need somebody who's going to help you uncover that. And I'll bet none of you have your hormones measured. There are hormones that help you make you degenerate, and there's hormones that make you regenerate. And it's your lifestyle that affects your hormones. Understanding if you're in balance. Are you regenerating or degenerating? Are you building up or breaking down? What is a healthy balance for you? I understand most people never get their hormones measured and don't know what to do when they're off balance. There are a lot of dietary measures that you can take, as well as balancing with bioidentical hormones, so you can feel your best, look your best, and function at your peak. In order to age well, live a healthy, full, productive life, whether you're an executive or not, it takes a little bit of understanding of what makes you tick. And you need to look beneath the surface. So when you come for a Vibrance for Life executive physical, you're not going to spend all your time in machines. You get me, and you get a unique perspective. We look at what's optimal, not just what's normal. Because don't you want to function optimally and not just be normal for your age? That's no fun. So I welcome you to visit my website, howtoliveyounger.com, and download my information about the Vibrance for Life Executive Physical for yourself, or if you're a company, for you and your team. Because wouldn't it be great if you can function at your peak and have peak performance in your personal and professional life? Call my office and schedule a Vibrance for Life Executive Physical, and download the information on howtoliveyounger.com. I really want to help. I want to help you live younger and healthier. Thank you for listening. This is Dr. Lorraine Maita from howtoliveyounger.com.